Hello, everyone, and welcome to this audio podcast. This audio podcast as part of the Pathogenesis edition. This audio podcast as part of the Torpedo Storm. This audio podcast as part of the Storm Richter, and this audio podcast as part of a Storm Logistics production. This audio podcast will sort of go into sort of looking at sort of networks and commissioning aspects pertaining to kidney care practices kidney care practices in around young people, and also in around kidney care practices and young people or pediatric nephrology, and so thus understanding sort of costs and remunerations of where value can be added in the care of young people with CKD. CKD, or chronic kidney disease, would aid service providers and decision makers with how to provide and or integrate the best care or best practices for this patient population. At the same time, research has been developing on how to best detect CKD in young people, looking at which patients are affected and which and what the optimal monitoring intervals are between blood tests blood test investigations, and when the right time when the right time is for referral to specialist practices. So, prospectively, research would need to identify sort of the skills, competencies, and added value to support patients who have renal or kidney insufficiency aligned to CKD. Um, in the peer review works from 2018, looking at service evaluation in young people suffering with a CKD, there is more in around aspects aligned to sort of networks and commissioning. That draws this audio podcast to a close. In around this audio podcast as part of the Pathogenesis edition. This audio podcast as part of the Torpedo Storm. This audio podcast as part of the Storm Richter. And this audio podcast as part of the Storm Logistics production. And this audio podcast as part of this audio podcast and delving into a sort of a perspective in line to sort of peer review works on networks and commissioning for young people suffering with kidney disease or CKD.